they get a portal message.
Yeah.
Hey, you're
Everything looks normal.
everything is good
You're
except for vitamin D, and you should take an
Yes.
over the counter. Welcome back to Longevity Lounge. Today I'm excited to talk to Meredith Villarreal, who is a nurse practitioner, and welcome.
Thank you. I'm excited to be here.
So let's start off with your journey into medicine. You were a nurse first, so tell me when that was and how long you were there.
I always knew I wanted to be a nurse practitioner, which seems like a weird thing to say like as a kid, but I had my little Fisher-Price kit.
Oh.
I remember wearing my stethoscope. My dad was always my patient, and I knew I was going to go into medicine, but I somehow did not want to be a doctor. Like nurse was the route I wanted to go. And so I graduated in 2007 from Grand Canyon University because I'm a Arizona born and raised girl. And I worked bedside at the hospital throughout nursing school and then for the next 7 years. So I was in the hospital for about 9 years before I then started as a nurse practitioner in the primary care, urgent care setting.
And you were in Arizona for how many years?
My whole life. I moved here. I worked at a primary care, urgent care in Glendale, Arizona, literally in the neighborhood where I grew up. I'd gotten my corsage like next door. My first job was the pizza place across the street. So kept very close in the neighborhood. I thought I'd be in Arizona forever, but I was at that clinic for about 3 years and then completely burnt out and just decided I would reroute, do med spa life, moved to Chicago for my now husband and worked at a med spa. And within 7 months was like, absolutely not. I miss medicine. I miss my patients. And I Googled private owned clinic and innovative care came up.
Right. Well, great. So I'm Dr. Rahul Khare. I am the owner of Innovative Care. And I remember getting an email from you. We had just opened up a med spa, or we're really early on as well. And I had this candidate that was a nurse practitioner and a med spa practitioner. And I was like, oh my God, I have to interview you. And I remember I did and hired you on the spot. Right.
Yeah.
And so during that time, you worked in our traditional primary care. Innovative primary care is what it's called now. And there are 4 clinics in the Chicagoland area. And how many years were you there?
Well, when I started, we only had that one clinic.
Right.
Like it was like the OG 2400 Ashland location. And I started as urgent care.
Mm-hmm.
And I think my first shift, you were like, will you come full-time primary care? And that was the goal anyway. So it was perfect. So I've been with you since 2018.
Wow. And so you were doing traditional primary care and we are seeing everything there. So, and we use insurance there.
Mm-hmm.
And let's talk a little bit about that because we're going to talk about longevity medicine and the differences later on. But traditional primary care, it's a lot of work.
Yes, it is a lot of work. And that's where I had switched to med spa because in my first primary care where I worked, I was completely burnt out. Patients are sick. And sick, multiple comorbidities. It's blood pressure, it's diabetes, it's cholesterol, in addition to 8 million other small things that you just hadn't even thought about before. There's so many meds patients are on. And I think in normal primary care, you get used to the patient's just baseline being sick.
Right. And so, they're 15-minute, 20-minute appointments. And you're all day long.
Yeah.
You're working 35 hours a week, but then you have prior authorizations, portal messages, and all of that. So it was a grind.
And if you think about it, I wrote a Substack article about like a 15-minute primary care appointment. And if right on the dot, let's say that the patient gets there early and has filled out all their paperwork and the medical assistant is able to take them back right at that 0 mark, you still then have a scale that you're going to get on. You're going to get vitals. If you live in Chicago and it's winter, you have to take off half your clothing before you get on a scale. And by the time the provider sees you, it's minute 7 or 8, right? So we really only have like 7 minutes with the patient to address everything to keep on track.
Right. And obviously that makes it hard. It's more like checkbox medicine.
Yeah.
And you really don't want your patients to bring up much, right?
Right.
Because
Right.
you don't have enough time.
You barely have time to address one thing, much less the multiple things. And I remember even as a patient when I was a nurse, I would go into an office and like my women's wellness exam for my PAP, they had me sign a clipboard that said, you will not ask any questions. You will not ask for refills. This is a wellness exam only. There's nothing else.
Wow.
And I remember like thinking as a patient, like, I don't want to come back here. Like,
Right.
this is where I thought you'd address everything. I had a list. Like,
Right.
this is very frustrating.
Right. So we'll get more into that. And then I remember discussing with you, and we didn't call it longevity medicine at that time. It was something else, but we knew that there had to be a better way.
Yeah.
Right?
I think we called maybe concierge, but
Right.
we didn't understand.
Right.
We
Right.
wanted that more like direct personal.
Right. Right.
But we didn't know behind that what else.
And I remember taking you, Dr. Ghazi, another provider, to a longevity conference.
Yes.
And that's where we were like blown away.
Yeah. It changed a lot. And I think we'd been kind of tiptoeing in it mentally before that, but it was like, wow, this is really going to happen. Like, this is a thing people are doing.
Yeah, there was a science behind it. And I remember my turning point was when my mom turned to me and was like, which of your providers should I see? And I was like, oh, Mom, you need something more. And I'm building the primary care in the north side of Chicago. And that kind of scared me. So it was like, we need to build something.
Yeah, that's eye-opening. Definitely.
Right. So let's go into longevity medicine. Longevity medicine, it's just a word, but what is it to you? There's no right answer for this. So what do you consider longevity medicine?
So longevity medicine to me is us trying to live our longest life at the best quality, I suppose. Like, my goal is not to live forever, but I want to be able to be strong and independent and feel my best as I'm getting older. I think back to my hospital days where you have patients that are bedridden, that need help to the restroom, that have bed sores, and it just like breaks your heart. And those are visuals, I know you have them too, that will never leave my mind.
Mhm.
So that's the type of thing that when I get older, I'm thinking, how can I be my healthiest, feel my best, and live my best type of life?
Right. So longevity medicine is not only the length of time, but the quality of life during that time,
Yes,
right?
absolutely.
And what we've realized is the earlier you start, the better you are, right?
Truly, prevention is everything. And also that it's not too late. I think that I remember thinking like in my 30s, like, oh, I should have done better in my teens. I should have done better in my 20s. It's like, you're a baby still. Like,
Right.
I'm 41 now, and this is when I get to put the hard work in and like see those benefits. And it's exciting to think that we still have so much control over what's ahead. And these are the prime years, right? Like, I think you even talked about it before, like 30 to 50 and the changes that we really can make. It's not over. Like, it's just beginning.
Right. I mean, the diseases start at 30 to 50 years old, and we just start seeing them after that, right? So
Right.
number one disease is coronary artery disease and stroke. Number two is cancer. Number three is dementia. And those things actually can be prevented.
Right. Exactly. That is, I mean, prevention is realistic and doable. And it doesn't mean that you also are stuck in a bubble or have to be a robot and take 8 million supplements and have $1 billion. Like, it really is obtainable.
When most people think about prevention, they think, okay, I'm going to eat healthy and exercise, right? That's what we've been told. That's what we think of as healthy. And that is healthy.
Yeah, absolutely. Those are two really huge pillars.
But even though we tell people that, people who have money, who have insurance, who have, but I don't know if they have the education and really what is actual health. What do you do to your patients that make it so, you're different than, say, the traditional primary care?
Well, I think one of the beautiful parts, there's many beautiful parts, honestly, of Innovative Vitality. But for one, we have longer appointments. So I have 60 minutes to sit and get to know my patients in real life, not the quick, do you exercise and do you eat healthy, moving on, like
Mhm.
what does a day look like for you? Are you eating breakfast? Do you graze throughout the day? What's your job like? How many kids do you have? How many dogs do you have? We get to know them on such a personal level that becomes available to make a realistic plan of care as well. Because I think in traditional medicine and primary care, we kind of have these standard guideline plans of care that you
Yeah.
just put in: eat healthy, walk, um, you know, get get better, get some sleep. And it's like now I can say, okay, you normally get work until 8 p.m. So let's figure out what time you can eat dinner. And then can you move around? When can we work out and realistically plan a workout session? I think we also check amazing blood work. And
Right.
that's a huge factor too, is that this isn't just your 5 things checked off the list. We are looking at so many different biomarkers that truly allow us to be preventative with our care.
Yeah. Okay. We'll dive in. There's a lot there. So, Innovative Vitality is our longevity clinic. We're on the north side of Chicago. We have one location, and we have currently around 700 patients to date. We've been here for about a year and a half, 2 years. And you mentioned something about the time, right? So, traditional primary care, we talked about it, 15 minutes, maybe 7 to 9 minutes with your provider, right? After the vital signs, on the scale. Like, it is amazing to have an hour all of a sudden to really personally know your patients and them to get to actually know you, because they're going to be seeing you. There's not other people that they're going to see when you're not available. Honestly,
Right.
you're going to make those appointments. Tell me about the personalization. What in particular do you really love to focus on getting to know your patients that has been really eye-opening compared to traditional primary care?
I think it's truly when I talked about the aspect of a daily life, like I like to know what is causing the specific stress in your life. Is this a work thing that we need to talk about? Is this more of a community factor? Is there a mental health component? There's a lot of different things going on in people's lives, but also it's fascinating to me. I know with a lot of the w- women I have, that were mothers specifically, I always ask my patients, like, what are your hobbies? What are some of the things that you
Mm,
love? And so many of them all said, like, hobby, like, when would I have
right,
time for that?
right.
And it's kind of realizing and putting these formulas together with future patients of like, we need to be covering so much more ground than,
Yeah,
like you said, obviously eat healthy and exercise, but also what are you doing for yourself? And like, how are you feeding your
right.
soul?
So I love that. It sounds like personalization is really important. That, sounds obvious. Obviously, like, yeah, you'd like to get to know your doctor, but how many people right now don't know their provider at
Right.
all? And the provider doesn't really know them other than their disease processes,
Right.
right?
Absolutely.
So you personalize it. And then it sounds like, and this is what we do, but coaching is a big part of this, right?
Huge, huge partnership. All of us need accountability one place or another. And I think that I use the term coaching lightly because sometimes coaching's looked upon like
Mm,
you're going to tell me all these rules and what not to do. And you think of more of like the fear tactics or elimination. But for me, it's like I truly look at my patients as friends. And that sounds super cheesy and generic,
mm,
but like I really am sitting down and talking to you the same way I'm talking to my best friend at brunch. Like,
yeah,
what's going on in life? How are you feeling? Like, what's your favorite like breakfast right now? Like, is there anything new you're trying that I could try? Like, so many of my patients have amazing pointers. What books are you reading? But I think we need to have a lot more, like you said, not just personal, but really like, I don't think the word is intimate, but just like a genuine friendship in a
yeah.
sense. And like my patients know, like they can text me and,
Right.
it's going to be real.
Right. So that's one thing we do. We give them our phone numbers for texting,
We
for,
do.
for better or worse. But I think the personalization, and then you being your authentic self, because I know when you're in traditional primary care, you're one Meredith, and then when you're at Vitality, you're actually the Meredith that I know outside, right? And
Yeah.
that go out to dinner with and go to get drinks with. That's a fun Meredith.
Yeah.
Like that's the one, and our patients, just rave about you, of course, because
Thank
they love your personality, they love the connection that they get, and the 60 minutes allows for that.
Yes, we get to really know each other. And I'm definitely a sharer. I don't really hold back. And I think that helps patients to open up too, to know like you're not alone in these
Right.
struggles that you've had. And so many of them I've had myself, or I know somebody who's had this. And this is a judgment free zone. And I think that there's definitely patients where it takes a few visits to realize that that's the truth because they're so used to feeling judged, especially if it comes to weight loss, what they've done for weight loss, feeling just not like themselves, or even the sense of women asking for hormones to be checked.
Mm.
That a lot of women that have asked other providers and that, get their eyes rolled or were told everything's fine. And it's like, when you hear everything's fine and everything's normal, but you don't feel that way, it almost just is like dismissed. And you kind of build this wall up of like, is the next person going to listen to me? And so it kind of is us almost having to show the patients, like, you really can trust me. Like, I am here for you.
Yeah. So you brought up some of the things that we do that is very different than what we do at traditional primary care. Hormone replacement therapy for women is a hot topic right now,
Very
right?
trendy.
And there are still a lot of primary care providers that do not really help women with that. And
Right.
the thing about longevity clinics like ours, we're able to take the science, and even though it is not yet standardized, right? Because medicine takes a while for good reason.
Especially women's health.
Women health is neglected. We know that. And that's a good point. But, we're taking the newest science and really implementing it.
Yes.
And because we can have the appointment times and we're
Follow-ups.
we're educated in it, right?
Right.
So tell us about some of the things that we're doing that many primary cares just haven't gotten to yet.
There's a large variety of things that we are doing that's very different and that we're able to do because we have extended time with the patients and a lot more closer follow-up. And that includes just in the realm of even GLPs, which the GLP-1 medications are so trendy right now.
Mm-hmm.
And they are being prescribed a lot, but unfortunately, they're not being monitored.
Right.
And patients are not as educated as they should be on these meds. And the beautiful thing with us that we are really great at is that's where you're talking about coaching the patients, but educating them on this is how you take the medication responsibly and effectively, but maintain your muscle, if not build muscle. The goal is not, just to be skinny. We're trying to improve metabolic health and get you stronger. And in regards to women's health, it's this large kind of somewhat uncharted territory at times. And the beautiful thing with our patients is we have the time to say, okay, this might be a little outside the box, but it's appropriate. Let's try it. Let's try this patch, and maybe we need to add on a gel as well. Let's talk about birth control options, or maybe switching you to something else or adding something on top of it. It's just, we can be really close enough with our patients to say, text me in 2 days. Let me know how this is going. If you have any side effect, you tell me. I'm right there. And that's
right. I love that
safety.
point because especially with hormone replacement, it's not a set it and forget it. The ovaries are cyclically giving off estrogen and progesterone, and sometimes you get a lot of it, and sometimes you get none of it,
Yeah.
and the hot flashes and the symptoms. And so you have to constantly be updating the creams and all of those things. And they aren't, okay, see me in a month,
Yes.
right?
Or even in a lot of cases, they say, see you next year.
Right.
And it's just absolutely wild because 2 weeks later, there's patients that are like, I feel terrible. I thought I was supposed to feel better.
Right.
Like, this doesn't make any sense. My algorithm told me I'd be fine, know, and it's not that simple.
Right. And so, and the one thing that all connects this is because you now have a close relationship to them, they're more willing to be like, is this normal?
Yeah.
And you can say yes or no, we are going to change things.
Right.
And so I love the adaptiveness of the longevity clinic that we have where we can change things so quickly.
Right. Exactly. And there are no stupid questions. Tell me if any little thing is here. And it feels really comforting for a patient to say, you know what? I know that I can text you in the middle of the night and you're going to see it in the morning and reply like everything's fine, or let's schedule a quick telemed and check in with you. You know, stop this now. I'm sending something else. Like, we have an answer. You're in good hands. You have eyes on you always.
Right. And because you have that trust, you know, you can start to educate them. There's a big stigma between both the things you said. Hormone replacement therapy. My mom said not to do that. It causes breast cancer. I mean, we've heard that over and over
Right.
again, but we can sit with them for 10, 15 minutes and be like,
Hmm.
listen, they've actually taken that label off.
Yeah.
Here's the studies that
Let's
show it.
talk about the Women's Health
Right.
Initiative. I have 10 minutes to give you
Right.
everything that went wrong.
Right.
Yeah.
And then GLPs, huge stigma behind that. Where that's a
It's its own.
crutch. I don't want to do it. I don't want to cheat. And we're like,
Right.
we're talking about, look at your hemoglobin A1C, look
Mhm.
at your
Look at these
inflammatory
blood
markers.
sugars that you're having on a continuous glucose
Right.
monitor. Look
Right.
at your inflammation
So
markers.
that's a great example. Blood sugar monitoring,
Mhm.
right? Not covered by insurance, but and not given out normally in traditional primary care. We snap those on almost every patient.
Yeah.
And
Yeah.
that's for them to understand their
Right.
metabolic health, to be like, why did I wake up and it's 110?
That was one of the most eye-opening things personally I did that I tell patients about,
Mm,
where it connected so many dots of my roller coaster energy levels throughout the day, my sleep, even if I was in bed for 8 hours, just not feeling restful. And I was part of the, culture of like calorie counting. And
right.
if you're good all day, then I get my sweet treat right before bedtime. And then
Mhm.
realizing with the glucose monitor, like I am setting myself up for failure. I am literally saving that sweet treat, 200 calories for bed, and then lying sedentary for 8 hours and
Yeah.
just letting my body go to full work to try to control this blood sugar.
We're all going through the journey too.
Yes.
So tell us about your longevity journey, because we started learning about it and we started to understand the science, and then we had to go through it
Yeah.
ourselves.
Right.
So tell us about what you learned about you, what changes you've made. And I know there are a lot of them.
So many. I think, and I really think that's what sets us apart, is that we did this all before we started
Mhm.
seeing the patients. And I cannot imagine trying to guide my patients on this journey without having done these things myself.
Right.
Like I made the mistakes so that patients don't have to.
Yeah.
But I would say my journey started probably after COVID. I feel like COVID really took a toll mentally, physically. We were working really long
You were
hours.
working in my COVID
I was working outside in the
testing
parking
center.
lot in March through June, and rain and storms and whatnot. And I was coming home, and my husband would have my Moscow Mule waiting for me. And
Mhm. Yep.
sometimes it was two. And I was drinking more just to kind of cope. And I was eating whatever I wanted because,
It
it
was
was a
COVID.
tough time.
Yeah.
And I think 2021 was like, what am I doing? Like, this is weight that I'd put on that I normally could snap and take 2 weeks and work out every day and it would come off, and it wasn't happening. And I was eating as healthy as you could. I was following my macros. I know the things to do. I was working out sometimes twice a day just to try to lose. It got to the point where I'm like, if I lose 2 pounds, I'm happy, but I need to be losing 20 pounds.
Um,
And it was the fact of, if I look at a BMI, yes, it's normal or just slightly overweight, but it was all visceral fat.
yeah.
My body composition was different from stress,
Mhm.
from a lifestyle that wasn't the healthiest. And I was doing everything I could. And it was like this deadbolt on the door. And I kind of talked to patients about that, of like, especially women, especially perimenopause transition, you have these keys that fit in the lock that always open the door. You have the fitness key and the nutrition key, but there's a deadbolt now there.
Mm.
And my husband's keys fit in the lock and open the door fine, which is infuriating. But mine had the deadbolt. And that's where, we all, prior to starting Vitality, kind of talked about the GLPs and what's going on with them. And I did. I took Mounjaro for a while. Zepbound wasn't about available yet,
Right.
but we tried, and it lowered my inflammation. My triglycerides, of course, had gone up from my drinking, from my poor eating habits, and they hadn't improved despite exercise and
Mm.
despite healthier eating. And so it lowered my triglycerides, it lowered my inflammation and my visceral fat. But this was in conjunction with proper nutrition, continuing my strength training, and doing all the things.
Right.
And I was an example case that's a little bit different, that I didn't need to be on it forever. I didn't need, which is pretty, rare. I tell a lot of patients, don't expect to suddenly go off these.
Sure.
They're not a
But it is
short-term
possible.
answer, but it is possible, because if you're continuing with the right lifestyle,
Right.
right? which I do. And so I'm all for it. But I tell patients, like, this was my story. I am right there with you. I dealt with some of the nausea. I dealt with the headaches and realized we need the electrolytes in the water. We need to do these things in order to continue. And I lost 25 pounds.
Wow.
My visceral fat is now optimal. My metabolic shape on an in-body scan is where we want it. And strength training has been like the continued amazingness that is now my stress relief, my coping mechanisms. It is the best confidence builder, I would say, that you could get.
And probably the number one reason you're not on a GLP anymore, right?
Yeah. Absolutely.
Because that's the trick, right? And I think that the coaching, because for a person like myself who never really worked out, I never hit the gym. I would do cardio. I would get on the treadmill like everyone told me to, and I would run a little bit, but it wasn't cutting it. When I went through this, it was habit formation, right? And I was like, one time a week, I'm going to do that with a trainer. And then I hit a second time by myself. And then I was like getting to like it and seeing the changes, right?
Lifting heavier, doing a pull-up. Never thought I would do this in my life. Who am I? Who am I? Like, that is cool.
Yes, we have pull-up competitions. So I think without the coaching, that's very difficult to do.
Absolutely. You need someone. And I think it's nice to have someone who's been there and who's gone through it and understands and says, not just that I read in a book, these are the expected side effects. Like, I've felt that, and this is why. And did you try this?
Right. And everyone's different, right? So everyone's bottleneck, I like to say everyone's bottleneck is different. And we get the time to ask about it. It's that I have 3 kids, or it's that I work 12-hour shifts, night shifts, and I don't find the time. And it's like, we problem solve with them to understand their issues, to say, hey, you need support on this. So please reach out to your partner or buy the support, whatever it is, because everyone is different. It's not as easy as, go to the gym 3 days a week.
Right. And also, I was waking up at 5 a.m., interrupting my sleep to go to Barry's boot camp.
Yeah, we were doing the wrong thing. And you were doing
everything wrong.
And your cortisol was probably
through the roof. And I was just in overstress mode, and it wasn't going to change.
But that's longevity medicine. It's like, whoa, your cortisol is too high. That hit isn't the right exercise for you, even though you're feeling.
We were told, you said to work out.
Right. No, that's great. I love that. I love that. So one of the things I wanted to bring up that a lot of people talk to me about is like, well, why didn't you do this in your 4 other clinics, your traditional primary care clinics? I think to really understand that question and why we had to break off and open a new clinic was how the providers get paid.
The reimbursement factors is with the insurance is huge. Right. Factor involved.
So for these longevity clinics to spend more time with you, to do the coaching, often that isn't reimbursed, right? We have a subscription fee of $250 per month to subsidize the things we have to do in order to make healthy changes in our patients. And so that is the model we created at Innovative Vitality. And that was the big turning point of where we could still make some money, at least to pay our providers well, and to see the patients and give them the results they want. And I think what's cool about Innovative Vitality is that we still use your insurance because we're using it. We're still,
I'm going through insurance for all of your labs. And if they're sending you a bill, you're texting me and I'm seeing what can I code? How can I work with them? What letters can I send?
Or do the prior authorization and not just do one and say it didn't work.
Exactly.
It's like, okay, this is a project.
Yes.
Now your GLP.
You're going to figure this out.
Yes. Yeah.
You are in my hands and I got this. And you don't need to also be calling and stressing like I'm going to fight.
Right. And because of the subscription fee, we can hire an army of people to do the prior authorizations, to really go at bat, to do them 2 or 3 times.
Multiple times.
Yes.
Unfortunately.
Right. Now my question is, what do you really focus on? What are your tiers of things that you really love to help your patients with?
I would say first appointment, we do blood work. And second appointment is a solid hour at least of going over every single value. It's my favorite appointment, even though it's the most exhausting appointment.
Right. So let's get into that because, most people who've never seen a longevity physician, they get a portal message.
Yeah.
Hey, you're
Everything looks normal.
Everything is good
You're
except for vitamin D, and you should take it
Yes.
over the counter. And like, how many times did you used to tell people that?
That was my dot phrase.
So yes, so that
absolutely.
was your templated phrase. So let's talk about these labs. We check way more than our standard. So what are some of the ones that you really love checking, and what are their importance?
I do have my favorites, which is a silly, nerdy thing to say as a provider, but I love HSCRP. I think everyone should be checking a high sensitive C-reactive protein.
Right.
It to me is like my red flag marker, and especially again, the perimenopause to menopause transition, because the cardiovascular risk is real. And as our estradiol just drops and goes away forever, our cardiovascular risk goes up. And I watch that number just rise.
Right.
And that's in addition to not just the standard lipid panel, but the apolipoB protein and the lipoprotein A, which I love that like new guidelines are coming out, and hopefully more
They just adjusted them,
offices should be checking this.
right.
And I pray they are, because that's really what we need to be guiding our care off of. That's just the most important factor to me. And I love coming from bedside nursing, working on cardiac floors. Like, my passion involves more of that cardiac health. And to see those markers and say, this is what's telling us the real story. Patients always come in and say, my total cholesterol. And I'm like, I don't care. I don't care what that number is. We need to look at your HDL, your triglycerides, your LDL, and let's look at your apolipoB and lipoprotein A, which usually have never been checked.
Well, isn't it amazing that if you can correct this or start working on it in your 30s and 40s,
Yes.
we could potentially prevent 99% of heart attacks and stroke.
Truly, truly, truly. And that's where I get so excited to talk to patients about. And I also think I've had a really big mental shift in this idea of medicine and care, because I think back in the day, no patient wants to be on a med. All my patients were on medications. And to me, it was like that was almost a failure. I was like, well, I don't want to put you on any medications if I don't have to. And I prolonged the wait. And I have this kind of like guilt on my chest now, where I think back of like, maybe I should have started certain statins sooner. Maybe I should have started metformin or different things from a prevention standpoint. Right. But to me, a medication meant you failed. And I think the patient saw that too, which is why a lot of patients come in like, I don't want to be on meds. And you're like, but you're here to prevent. And that sometimes means you are taking a medication. Big pharma has this terrible stigma against it. And we don't get paid for writing a prescription.
We don't.
I know people seem to think that we do. I promise we don't. Even the pharmaceutical dinners, we don't even get to order drinks anymore. We get nothing. But I do think there's been a big shift. And I can think back, and this is like one of those core memories that haunts me, of like calling a patient probably 10 years ago and going over their labs and saying, your A1C, which is an average blood sugar over 3 years. Over 3 months, sorry. Average blood sugar over 3 months. And it's what we use for insurance companies to diagnose diabetes. 6.5 and above is diabetes. 5.7 to 6.4 is pre-diabetes. And I remember telling the patient, your A1C is 5.7, but you're just barely pre-diabetic.
Right.
And like those were sentences we said,
we still do.
Like, yeah, a lot still do. And I think now, like if my patient's A1C is 5.7, I'm like, we got to handle this. We have to handle this immediately. Yes. It is. It's just so interesting. And I'm so thankful that my mind has shifted and opened up. But when you're kind of stuck in this, primary care, traditional medicine place, we see so many sick patients that we're almost comparing sick to normal, right? A patient comes in, you're like, you're only on one med, like you're doing fine. You should see my other patients. As opposed to saying like, you should be feeling amazing. You should be optimal. Like I wasn't holding people up to that standard.
That's absolutely, I love that. I mean, the diabetes part especially, right? If I see a 5.6, we're like, I tell them, you're pre-diabetic.
Yeah.
Now, your labs are normal, And they're just like,
Mm-hmm.
well, why are we treating me like a diabetic? I'm like, no, we're preventing diabetes.
Mm-hmm.
Because by the way, your mother has it, your uncle has it, your brother has it,
Right.
and you're on your
Right.
way there. So let's start treating it. And we're actually using medications that are traditionally used for diabetes to lower it. But the cool thing is, while we're treating them, we're getting them to exercise more.
Yes.
We're putting that blood sugar monitor. We're decreasing their carb load. We're increasing the protein. And all of a sudden, 6 months, 8 months later, I'm actually decreasing the diabetes medication,
Right.
if
You
not
don't.
taking it off.
Exactly.
Right?
Those meds we can eventually then take off because we've created the behaviors.
Right.
Yeah.
Right. Okay. So you mentioned apolipoprotein B,
Insulin.
LP, little
Insulin's
a,
another
insulin.
one. And I
Yes.
think that's a big one that does not get checked, especially on women
Yeah.
and our PCOS population that is severely undiagnosed. And I love checking an insulin level because I really think that's very eye opening because
Yeah.
insulin's so inflammatory. Why is that not part of our
Right.
everyday marker?
PCOS is another diagnosis that a significant amount of women have, young women who we treat it, who traditionally, we don't even treat it. We
Right.
treat it for the
Maybe
symptoms
birth
that,
control.
yeah, and which is not the great way to treat it, right? So a lot of those patients who get the metformin, who get on the GLP,
Yeah.
they're getting pregnant.
Yeah. Yeah. Patients who have done IVF repeatedly
Mhm.
and that don't believe you, right? Where
Right.
you're putting on a GLP, like you might need to think about contraception if you're not trying to get
Right.
pregnant. And they all roll their eyes and laugh. And the amount of calls we've gotten, like
Right.
it's a beautiful thing
Right.
because we're treating the metabolic syndrome, and it was never discussed that way before.
Right. Okay, so those are the labs that we do, and we do over 100 biomarkers, right? And we sit down with them. This is your favorite, but exhausting.
Yes.
And we go through every one of them, and we
Mhm.
don't talk about the normals. We talk about optimal. We don't
Exactly.
care about the normals.
Right.
80% of the population is overweight or obese in our country. Why do we want normal? Right.
And also normal, I mean, think of a B12 normal reference range.
Right.
It's like 190 to 900.
Right.
That's an insane reference point. I
Right.
mean, this is what we're dealing with.
Right. And the same goes for men's health and testosterone.
Oh my gosh, yeah.
Oh, you're in the normal
Whole
range.
story.
And it's
Yeah.
like that. How are you feeling? Oh, terrible. Well,
Yeah.
let's talk about how to
Right.
improve that. Right. And then some of the other things we do, whole body MRI and genetic testing to look at increased risks of certain disease processes.
Yeah, absolutely. The Prenuvo, the whole body
Mhm.
MRI. I did one. You've done one. I
Mhm.
loved it. I thought
Yeah.
it was great. I think that we offer what you want. And that's the thing is some patients come in that want everything possible. Give me the moon, give me the sun, I'll take it. And there's others that say, I just want to focus on this. And the nice thing is I'm going to present you with every option available.
Right.
It doesn't mean I'm forcing you. I just let you know. And sometimes we put things on the back burner. We'll revisit. There's nothing that's a sudden
Right.
instant. You must decide.
Mhm.
I'll see you next week.
Right.
We'll talk
Right.
about it again.
Well, I think there's some skepticism of just seeing a doctor, and it's just like, well, I only want to work on my weight. And it's like, okay, we'll work on that. But all of a sudden, they get this trust with you. You have them lose 30 to 40 pounds, and they're like,
Mhm.
wait, what's next? It's like, we got to do muscle now, and like,
Right.
that's a totally different diet, a totally different way of doing
Absolutely.
things. And then we switch gears.
Shift. Yeah.
And we're like, okay, it's not about eating less carbs now. It's actually
Yeah.
eating more protein, and we may want to check that with you, right?
And I think that phase 2, and I'll say just personally, but I think for a lot of women, the mental component of that is really difficult
Yeah.
because we've just focused on weight loss, which to my generation meant calorie counting, no carbs, carbs are evil, and all of these different rules. And now you're getting into muscle building where it's like, wait, I'm supposed to eat some carbs now, but like my blood sugar, and what about this? And we pay attention to just that number on the scale,
Right.
which we have to remind you, like it might shift, it might go up as you're
Right.
gaining muscle, and that's okay.
Right.
How do you feel? How are you checking in? And I know personally, it took me over a year to feel comfortable with getting on a scale. And my whole goal was to build muscle. And I talk about this every day. And I still was like, it's okay. How do your genes
Right.
fit? What's
Right.
going on? So it's a lot of hand holding just from a comfort point because we've really been messed up from media and told,
Right.
your scale is your end all be all and the weight is everything. And it's not. So
Right.
it's us constantly reminding people
Right.
that too.
So you brought up phase 2. So we do these things in phases. Phase 1 is to get to ideal body weight. And then phase 2 actually is increased muscle mass, right? And people ask, well, can't you do it at the same time? Why do you do it? And it's really difficult to do. So
And depends on the patient.
Right.
There might be some outliers. That's
Sure.
great. But for a lot of the patients, also, let's not try to overwhelm you.
Absolutely.
Like,
Right.
Can we just do one thing at a time? Like our society is like, and then I'm going to hire the trainer and I'll start the GLP and I'm going to throw everything away. And you're like, hold on.
Yeah,
This
don't
is
do that.
supposed to be realistic.
Right.
Like, I'm not telling you to give everything up. Like,
Right.
what is your life? We're going to make sure you fit into this lifestyle.
And if you're trying to lose 30, 40 pounds, right? Like, and to add muscle during that time, I mean, you need about 10 to 11 hours of sleep. You need almost a chef to be there to get your macros to high protein, low carb. Like, it's very unrealistic. Movie stars do it, but they have those people.
Right.
They have the trainer, they have the chef, they have,
Millions.
a lot of money to support them to do that, and they can do it. It's not realistic.
Right.
So, and then the sleep is so important too.
So important.
And how about these metrics like the Oura Ring, the Whoop Ring? How often are you checking that, or are you at all?
I am well, I mean, as someone who loves her Oura Ring, like most patients are bringing it up during the appointment.
Yeah.
Look at my sleep score. Look at this.
That's great.
What's going on here? And so there is a borderline. I don't want you to obsess over it, but I think it's interesting as a factor. And I do think it's really helpful with sleep because there's patients who are doing all the things and even adding on a GLP and not losing weight, and it's the sleep. And so we really have to investigate every aspect.
Right. And that's the cool thing that we can do. We now have these innovative, cutting edge, like things that we didn't even have 5 years ago, like at home sleep testing. You can get so much data from that, and that can diagnose sleep apnea. And if you're not sleeping well, forget about, eating well,
Right.
because you're going to be fatigued, brain fog,
Yeah.
and you will just
Forget
say,
about
okay.
hormones, right? Even testosterone, we can only do so much if you're not sleeping. Like that is truly the foundation.
Right. And so we can integrate all these new technologies. The Prenuvo, a lot of doctors are against this. Oh my God, you're going to find all these things and we don't know what to do with them. So we could find some great things. I found out, like, I have a little slip disc on my L4, lumbar 4 and 5. I always, after I'm in a car for over like 45 minutes, my back would hurt. And when I found that out, it was like, oh, that's why. I just need a little support. And it went away. And it was like, my life got a lot better. Like little things that it can teach you. And we're not talking about cancers that it's found and like, oh, you have abnormal anatomy. You need to get more tests on this. Like, it's been pretty remarkable.
Well, and additionally, if the patient wants it, why would you argue?
Right.
Like, yeah, let's do it. We're here for you. Like, that's the thing. Vitality, I feel like we're very on the same page of like, you got it.
I think the future discussions will be actually honing in on phase 1, like what we do exactly, what are the things we look at. And then phase 2, which I'm really excited, this is your specialty.
This is my passion, my bread and butter.
Building muscle, changing your entire diet to increase protein, to eat certain healthy carbs, to get those so you have the energy, and to
learn how to properly fuel.
Yes. And then compound lifting, right? And how we need coaches and trainers to teach us to properly do it, and then making it a habit to do it on your own, and then feeling good about it.
Feeling the best.
Yeah. I'm so excited for this.
Me too.
It's been a lot of fun talking with you, Meredith.
So much.
Thank you for joining us.
Anytime.